I'm playing with different teaching modalities. Of course we have this, and that'll work for some people, but I always hated lectures, as we talked about. I'm also bringing real things that people can smell and touch to understand the big picture. I'm bringing outside stuff so that people can see an example of how modern technology affects a business. Like this, my board up there that I put together, my little third grade diorama. Those things have near field communication touch devices. But that reaching this audience, no matter what their interests are, even if it's not ending up cannabis, there's something about cutting it yourself, doing it on your own that's worth it, right?
True. I have a question.
Yeah.
I mean, I don't know the same.
They are chemistry. It's chemistry. These are not. This is not cannabis per se. This is phyto.
Okay.
This is a. If you ground up a green leaf, no, it's okay. If you ground up a green leaf, this is what's in the beaker. Over in chemistry, they're using this. They're understanding this, right? These things which are locked up have product, and I don't know where that would go. I don't know if we can keep it locked. It's not going to be shared, but people sometimes have questions, and sometimes seeing it in real life is different. Nothing is available for anybody to consume.
Our club advisor will be here.
Great.
So we can ask her about this.
Right, it's locked up for now.
Yeah,
Whatever.
sure, yeah. I'm sure she'd be interested.
But it's weird to think sodium, illegal, the chemical. You can't have it, anybody can't have it. You have to have it in school amounts. You have to have it contained, you have to have a license to be able to buy it. It's not that different. If this is sodium, we can still teach about it.
Yeah, that's true.
And people aren't eating it. It might be illegal, but it's still, this is the interesting line, I think.
It's definitely interesting. I'm on so.
Yeah, me too.
Yeah, probably 4:45 will be a good time to start.
Cool. Yeah, no, whatever.
I said 4:30, close some time.
That's fine. Yeah, and Kristen Rogers is coming with
Yes.
non-dosed Levia.
How are you outside?
I'm great. I'm great. It's one thing I do is run, just like an investment portfolio, you have a diversity of investments. I have a diversity of investments of the things I'm putting energy into. The book is one. I have a separate clinic, which is another. I have teaching and counseling is another.
And a family.
And a family somewhere in there too.
How the hell do you do that?
Yeah. Well, I think when the will is there, the rest falls into place.
It's true.
And for most people, like 100% of people, there's not will there. They want to do the simplest possible thing they can. So I got will up the kazoo. How about you? How are things coming? How's classes?
Good.
Should I turn this on? Actually, there's no reason for the world to hear us and we're probably bored anyway.
Classes are going really well. This is the last week, so Friday's our last day of the semester.
Mm-hmm.
Things with my venture are going great.
For you guys, that's probably the takeaway. That if you can ask me questions like, if I had this idea, how do I meet people, how do I network, how do I get the word out there, how do I do marketing, any of those kinds of questions that are more meta, that's valuable too. Cool? All right. Understanding cannabis is a good place to start. Most people don't, especially doctors, which is a sad state of reality. This kind of cannabis you probably all know, but doesn't mean much from afar, and people didn't understand it, and they would roll it up and smoke it, which is just stupid.
Oops.
Like, oh, this is fancy. Transferred it over from another slide. If you zoom in on those fat plants, on each flower are these little penis-looking things. Inside here is a vein of hydrocarbons. So all of these things here are what the industry calls terpenes. Terpenes is just a fancy word for carbon. Meets hydrogen, meets another carbon. It's like the word shape as opposed to triangle or square. Terpene is just a hydrocarbon. Everything on Earth is the terpene. Cannabis has certain terpenes which you already know about. So if I show you here, I have linalool. This is a chemical which you probably know of as lavender. And if you think about hippie people who use lavender in their lotion to feel calm, oh, wait a minute, yeah, it seems like human history has told us that lavender makes people calm. And there's a whole wealth of literature about linalool that shows it does actually, in reproducible trials, create more calm than the other arm. And that's just one. Limonene. Everything that you know of as citrus smells like lemon. When you're on a fancy international flight and they hand you a wet towel that smells like lemon, you put it on your face, you feel calm. That's cheating, because actually the heat on your face calms you down anyway. But separate from that, even if it wasn't hot, the smell of lemon would be refreshing. That actually has evidence that shows people feel calmer with it. And I can go on. All of these are, and there's a slide in here you'll see later, but this stuff, this cannabis plant produces. And it's a freak factory of these things. That's the reason cannabis is interesting. It's not just a geranium or a rose, which produces geranium and one smell. This crazy plant produces 1,000. So if you think about it in pharmaceutical terms, imagine you have the ability to take all the pills behind the CVS counter, throw them in a blender. All of a sudden you have this mixture of crazy awesome pills that do all kinds of nice things. Well, guess what? That's exactly what this is, but just a natural version. If you froze this stuff, this is a waxy layer, just like you find wax on a leaf. And it will freeze and it will crack and break off. So what they do at the dispensary, that the dispensary grows, is they organically grow these things, because that's still more cost effective than the other options, which are plating. You can grow these cells in culture. You can also grow, I forget the name, but you have bacteria vectors and fungus vectors to be able to grow the same chemistry. These are all made from petroleum on the non-organic side and orange peel on the organic side. So if you look up organic terpenes online, you'll find these kinds of chemistry. And it seems, those are organic terpenes, that must be from marijuana. No, the producer of that is actually making it from orange peel because it's cheaper. And people who don't put organic on it, it's just petroleum. Sorry, if we freeze those things, so they grow plants, one person cuts off the flower part, or they shake it up with a machine, and then they freeze these so that the chemistry falls off. And they can use pretty simple chemistry to be able to extract a cauldron full of the mixture, these 1,000 item things. They filter that off and create whatever compound they want in a little vial, and they can then make a tincture, they can make a soda, they can make a candy bar, and they can put whatever they want in. And from a business opportunity perspective, I'll tell you, imagine that big fat cauldron of all of that stuff. They throw out a huge portion of that simply because they have no idea what they're doing. It's just not THC, it's not CBD, it's not the things that they know about. The industry is completely ignorant about the most valuable part of the crop they have. And of course, businesses have cropped up saying, oh, you know what, we'll take your biomass, the crap that you're throwing out, we'll find a use for that. There's nobody still that takes, there's one company I know of that takes this extra waxy stuff to create fuel out of it. Just like you guys have probably heard case studies of the jet fuel people, they take McDonald's oil and make jet fuel out of it. Same kind of thing, there's somebody trying to do that with cannabis. But think about the opportunity, I guess the punchline here is the opportunity. Knowing about this stuff, where it comes from, how it's valuable, is a whole business door open. All right, frozen stuff, they smash it together into different amounts of waxy stuff. Some of this is really hard, some of it's really goopy, some of it's really sticky, some of it's like taffy. And those, people like, and there's a whole market for those individual stickinesses. But there's also ways you can make other stuff. Any questions about this? So this is called wax, butter, shatter. There's a whole bunch of funky names for it, but it's all basically the same stuff with different degrees of wax as opposed to cannabis active ingredients.
Super concentrated.
And then, this is a good sort of link to the tincture that you guys have that you put into the seltzers.
So we have seltzers, but also there's 5 milligrams is great for me, but there's a lot of people who could have 100 and look the same after me after 5. We make a tincture called drink drops as well, so that you could literally make this as you could go up to 30 really without tasting it at all. But and that way, other people can have the same feeling. we don't want to mess anyone up, but at the same time, there are people who just won't even feel this.
How did you guys come into we want this stuff in the seltzers?
Like the emulsion and everything? We want
This product, like how much THC, I mean, I get the dosage you were talking about,
Yeah.
but why not all of the other terpenes? Why did you, maybe correct me if I'm wrong, but my assumption is you guys took out the THC and made a decision about what percentage of THC you wanted per can. So how did it work?
So we started with the tincture, but we knew we didn't want to just do distillate. So distillate is when you just take the THC. And we wanted everyone to have the full effect of the flower, so we use a CO2 oil, so you're not losing out. You do lose a lot of the...
Two is the freezing of those trichomes so they fall off. You use super cooled CO2.
Yeah, and it does lose a lot of the terpenes, but it doesn't lose the minocannabinoids, so that's really cool. You can see it more in the tincture because this is 5 milligrams is so little when it really comes down to it that it's hard to see that in the testing because it only goes to the 10.
So let me take that run. There's a big awareness in the industry of pure products, distillates, versus whole spectrum, full plant stuff. And that's the culture's concept of tolerance. If you slam your brain's receptors with the same thing over and over, your brain starts to ignore it. If you do A molecule, B molecule, C molecule, those receptors in your brain don't disappear because they're getting different signals. So the culture has figured out this is a good thing, people don't want to become tolerant, we need broad spectrum stuff, we need whole plant stuff. It's a really fascinating phenomenon. To share that meta, we as a culture in the 60s, 70s figured out that cannabis was mind expanded. Far out, man, that was the thing. And now, whatever it is, 50, 60 years later, we're starting to understand that if you stick someone in a functional imaging machine, you look for the activity when someone's consuming cannabis, their whole brain lights up. It's not just one area, it's not just the area you might be interrogating, their whole brain. And some people understand it, some people don't. What's basically happening is if you think about, actually we'll cover it later in this lecture. For now, let's stick to the road. So I made this lecture as a sort of parallel to the book and what the book covers, but I'm not going into too much detail on any of it. The book does cover cannabis history in a small way. The punchline to take from the book, this is everywhere. It has been everywhere. It's been part of human history forever. It's just the last 100 years where this wasn't a main vein of medicine. And we all grew up in this insane reality where doctors, teachers aren't teaching the next generation because of racism, because of stigmatized idiocy from the 30s and 50s. CBD, THC is a basic topic, but very important. Basically, this cannabis plant has a male and has a female. They look different, they act different. Male plants have stringy sort of stalks. Female tends to do most of the heavy lifting when it comes to chemistry production. Hemp industry is actually now a $100 billion industry, so is the THC industry. The female industry, totally illegal. The male industry, totally legal from the Farm Bill in 2018. It's bonkers. Oh, shoot, I really don't. That has been studied, and people in that study were given fake cannabis products, and half of them still felt high.
I didn't feel high.
No, understood.
I'm just feeling the physiology aspect.
Something, some effect.
Something, and I just looked at it as like, okay.
And those of us in medicine, and you guys who probably know also, what concept does that bring up to you? When you feel something and it's not really there.
Placebo.
And what is the placebo effect? We have no idea. We don't know the material substance of the placebo effect. It's this thing that's right in the way, and it works 30% of the time. Oh, and pause. There's this really crazy plant that seems like really good for everything. But to imagine expectation as relevant to your experience of the world, that's relevant. So this is the difference between THC and CBD. I don't know how much chemistry you guys have or remember, but this is negligibly minuscule. And yet this whole world of business is totally separate. They do different stuff, that's the takeaway. Health benefits, this would take a whole lecture in its own. The book is really written to, wait a minute. There is a slide here. Which maybe it's a magical thing appearing.
Question.
Please.
So the male CBD and the female doesn't?
Good question. Female does too. The female sometimes makes more of it than the male, but the male is mostly THC, not only, but mostly. This is a core beef that all the farmers out there have with the regulations that legalize CBD, because it's legal up to a certain percentage. And if you wait to cut those living stocks too long, that percentage changes over the limit. So it's not just some magical percentage, it's you have to crop it at the right time. It's so illogical. Like it's a silly system built on ignorance. Male plants, if they meet female plants, turn into seeds. Semilla is the Spanish word for seed. Sensemilla is another word for cannabis, but when it's full of seeds. So they don't work together, so it has to be a totally separate industry. If you talk to dispensary systems, they have to build a whole infrastructure around keeping out outside pollen in case someone had a piece of pollen from the CBD plant and they come into the dispensary, that could make their whole, that's exaggerating, but they can make their whole crop nullified, their whole business gone. So you'll find if you go to a dispensary, they have these like magical airplane gusts of wind blowing you so that you lose all the pollen that might be on you, or they have you wear protective equipment just in the off chance you have pollen. It's a fascinating sort of element of the industry. And if someone figured out simply how to stop a plant from creating seeds, the dispensary industry would save probably hundreds of millions of dollars. It's fascinating. So anyway, the book covers lots of stuff, in part because cannabis hits almost every cell in your body. It is the most prolific populous communication system in the body, which should be shocking. If I told you we didn't know what serotonin was or adrenaline, you'd think that's crazy. It's fundamental to what it means to be alive. That's not even as popular as the cannabis system, the endocannabinoid system. So for me, as a young doctor, realizing that I'm seeing this window that other people aren't, I was like, I can read papers, I can tell other people to read papers. Doctors aren't going to do that. They're never going to be able to read that much in one period of time. So that's where this book comes from. And I had no idea that there's no real version of that out there until I got into it. I looked around and there's beautiful pictures in one plant and there's scientific studies that are artfully compiled in another, but there's no book which is written for everybody, meaning the public can read it, doctors can read it. So that sort of opportunity fell in my hands. But all of this stuff and how it intersects with medical illnesses is all in there.
And could you talk more about the endocannabinoid system?
This is just a vision of what I saw this week. Probably impacts everybody in the room to some degree. We all have trouble sleeping, we all have memory issues from time to time, we all have pain from time to time. If cannabis did nothing else but help people sleep better, think about what illnesses would get better simply because we sleep better. If it only did what people think it does, makes you feel good. If nothing else, that would be enough. And that's really what has driven the whole culture, I think, over time, against every single odd against it. Laws, cultural stigma, doctors telling them you're going to kill you're going to be a prostitute if you use this, all these crazy things we all grew up with. Even still, cannabis is now finally becoming legal. And it's because of all this stuff that kind of human culture has taken on by intuition. So is there interest in this stuff? I can skip this topics. There's so many topics here.
Regulatory stuff?
Yeah, is this of interest? Just having a business that has high regulations that are against it seems like it would be interesting, but maybe not.
For the honorable.
Okay, I'll cover it quickly. We did already. At the federal level, CBD is legal. At the state level, THC is allowed if you have licenses. It creates a really interesting business opportunity because if you have the brass to figure out the regulations, it's actually not that hard. If you guys have the brass to figure out how to make a conference happen, it's really not that hard. And you look back thinking, geez, that wasn't so bad. But going through it, taking the risk to do it, as a business owner, takes some guts. And you're taking a chance because people around you are telling you this isn't right, this isn't good, what are you, crazy? And I went through that too. And then rescheduling, I have this fortunate relationship with an influential political figure, and she thinks that rescheduling will happen around the corner, meaning first quarter of next year. And imagine that, like all of a sudden, the entire culture from the top down learns that cannabis is no longer this bad thing. It actually has medical value. And you know what, doctors, you can prescribe it. Any doctor who has a medical license can prescribe it. But wait a minute, there's nobody there. Literally nobody there. I'm like one of 5 or 10 people in the world who is not just throwing cards at people, and that's what they call cannabis medicine, where there's actual thought and academia behind it. That's pretty terrifying. As a doctor, think about what scenario, we'd have nothing like that. Just like there's no analog to what cannabis is to human experience. The closest I can come up with is the discovery of penicillin. It changed healthcare forever. The concept that we could kill invisible bacteria. But now we have this sort of panacea, and I hate to use that word, but it does from some degree. And nobody knows how to deal with it. There's no medical school education today. There's public stigma against it, so doctors feel stigmatized to do it. It's a real interesting problem. Obviously, there are business advantages to those limitations. Consumption methods. I'll throw these up there in case they stimulate questions, but I'll push through them pretty quickly. So flower, most people who think about cannabis think about smoking it. If I gave you broccoli and told you to incinerate it and eat it, that would seem pretty stupid. The same chemistry applies. All the active ingredients in cannabis boil at temperatures which are 1/10 of the temperature of flame. So really what's happening in a joint is the stuff that's burning here has enough distance from the plants closer to your lips that you're actually boiling. You're not just incinerating. But you get a random distribution of stuff because the heat is a random distribution. So people who are consuming joints, they're destroying all the product, 80% of it, as a wick, because one piece of cannabis is burning the next one. But they're also getting a random distribution of stuff, and who knows what it's going to do. That's why sometimes people feel attracted to it. Psychologically, we have intermittent reinforcement. That's a psychological concept you guys remember. Sometimes you get positive, sometimes you don't. It draws you more to the product. That's why people love smoking cannabis so much. So one of the other cool things about cannabis actually is that it takes so many different disciplines that I enjoy, like the psych, the chemistry, the business. All right, so concentrates is another thing. I mean, if you love coffee, watered down Americano, this is the espresso version of that in cannabis. People love it because it's instant gratification. It feels great right now, but boy, is a blast to your receptors. And you get then not addicted, but really used to that level of density. And this becomes a whole. Side note, the 2019 sort of vape crisis, where we are like, oh my God, vaping is killing people. The entire culture, couldn't really distinguish between cigarette nicotine vaping and cannabis vaping. They didn't really know which article was talking about which vaping because there wasn't information out there. But dispensary products are also producing products which is not the same quality as Joe Schmo on the street. And Joe Schmo on the street says, you know what, I want to make more profit from my homemade product. What can I do to cut it? And you would find, just as you would right now, if you put vitamin E acetate, that is safe to consume. But if you looked one step deeper, you'd see it's safe to consume topically. It's not safe to consume with your lungs. But people cooking up cannabis and selling it are not exactly scientists. So that's where we had deaths come, because people were cutting it with shouldn't have been added. Tinctures, sprays. So this is an interesting solution that just came up in this market in the summer. People like smoking cannabis because it works quickly, instant gratification. They don't like edibles because it takes a long time to start working, even though it lasts a lot longer. So a couple companies came up with the idea of back of the throat sprays, like Banaka sprays, if you guys know the breath freshener sprays. And the interesting thing about these is your back of your mouth has such density of tissue that you get an absorption very quick, you get an effect within 5 minutes. And you process it so quickly, it doesn't last more than like an hour. So there's now a non-inhaling version which works quickly. Same like the seltzers, actually, they work very quickly because of the gastromucosa, same principle. You have blood supply that's absorbing cannabinoids quickly, and they don't last as long as you would expect an edible to. I guess this is just shameless plug for the book. There's charts, it's not just a read the cover kind of thing. I put in charts here that people who are inexperienced can reference right away, and the book also has stuff that's really important for novices, important for experts. I didn't know how big this was going to be, so I included all this stuff there. Is worth its own industry itself, and there is a small industry coming up. I have patients, I have one patient in particular, I did a documentary on my YouTube channel. This guy is a musician and couldn't play music anymore because of the arthritis in his hands. Within 3 months of a topical regimen, he's back playing music, he's back earning income.
Why is that?
It's a good question.
Is it because it lowers your pain threshold?
No.
Or,
Yes and more.
okay.
The question really gets at how is cannabis working. And arthritis is inflammation locally that was physically stopping him from being able to move his fingers to be able to play his instrument. If he goes to the doctor today, he's going to be told your first line is over-the-counter anti-inflammatories. Those work a little bit. You need them to work more, so you take more, and your stomach is going to feel it. And your kidneys are going to feel it. What's the next level? Steroids. And some people do steroid injections from time to time, usually in your back, right? As I remember, we talked about it. But that's it. You don't have other choices. There's biologics now. And that's a heavy-duty gun. They're very expensive. Most insurances don't cover it. Cannabinoids are, depending on how you look at them, stronger than steroids, than the hospital choice. If you were on death's door with COVID, they put you in the hospital, they give you steroids to heal you. 30 to 50 times stronger than steroids. That should be mindful. Talk about the ethics, that we are in this puzzle of a country that demonizes cannabis. Look what we could be solving. And there's no sort of downside. The small downside of people that have adverse reactions is minuscule relative to the benefit. Yeah, so that's the other piece of your answer, actually. Thank you. So locally, you get local anti-inflammation. You also get local pain relief. And those are through different mechanisms. I can give a whole medical school lecture, but basically, your nerves have incoming ions and outgoing ions to equilibrate and create a signal. Cannabis interferes with that. So you actually literally have less signal going back. The way that cannabis works in the body, fast forward here. Every single cell in your system has cannabinoid receptors. The way it works in the nervous system is a feedback inhibition system. So when you think about moving your fingers, you think your spine connects to your spine, your brain connects to your spine, connects to your finger. Cannabinoids work the opposite way. Your finger connects to your spine and connects back to your brain. It's a backward system. This, I don't know which is forward and which is back, but basically the forward nerve signals to the previous nerve, chill out, calm down, stop blasting forward. Good timing. So what's happening in someone's arthritis is that signal is making them feel less pain, less discomfort over time. And if their brain is saying, oh, we're not as worried about this situation, the pain is not so bad, let's send less inflammation that way too. So there's a local effect when you're using it, but there's also a long-term effect even when you're not using it. And by the way, this is completely beyond the scope of medical school. They have no idea. Because nobody's reading this. It's just nuts. Shifting fertility. You would think, wait a minute, cannabis is bad for fertility. I'm going there with lubes. Cannabis is bad for fertility, right? Because it stops sperm or something I heard about when I was a kid. And that's true, actually. If you look under a microscope, you will see cells that have cannabis infused in them. They move a little bit less rapidly. They're not stable, they're not dead, they just move a little bit slower. And the same thing is true if you look at women's fallopian tubes. They have what are called fibria, little fingers, that are supposed to lull the ovum to the uterus. If you give those cannabis, they stop moving as quickly. They're a little bit more rigid. So if you stopped your analysis there, boy, is it clear cannabis is bad for fertility. And that's the reality. If you zoom out, if you have a wherewithal to look at public health data, publicly available maps of regions of the world that have cannabis that's prevalent or have fertility information that's available, you can just do a simple overlay. Where are the countries that have good fertility? Where are the countries that have access to cannabis? Anybody want to venture a guess? I'm setting them up. The countries that have extremely high rates of cannabis are also the ones that have the most fertility. And why is that? Because people feel more comfortable. They're less anxious. They're having more sex. It's not just about looking under the microscope and what reality that tells. Yet our whole culture has this single-minded view. This is a simple view of how different forms of cannabis work over time. For whatever reason, this is new and fascinating to the dispensary world, to think about it, the people who are on the front line selling this product, most of them know at this point, I think. Maybe I'm being mean. But the idea here is some things work quickly, but don't last a long time. Some things don't work right away, last a long time, and some things are in the middle. Good question. There's so many ways to slice it, but the method of consumption changes your body's absorption of that thing. It's either fast or long or dense or not dense. If you add time as a variable, perspective, if you zoom out, when you take cannabis now, you're going to feel an effect. Your hands will feel better, or whatever. You sleep a little bit better right now. When you take it for the second or third week, cannabis is a fatty molecule. It's stored in your cells, in your fat cells of your body, and it releases a little bit each day. And as you've been taking it for 2 or 3 weeks, a little bit gets released into your system, and you actually have a sort of baseline cannabis flow. If we use non-cannabis thinking, there are people who are happy-go-lucky, and they have naturally high prevalence of anandamide, which is the body's analog of THC. And there are those grumps, those folks who just can't have a happy day. They have a different level of anandamide than the people who don't. We all know this stuff. It's part of human culture. It's just finally we have a plant that makes sense as an analog. Is that getting it? So the specific answer of your question is it doesn't matter. If you're taking something for a long period of time, it's going to equilibrate. You'll find a happy medium. This is an interesting perspective. So cannabis, I mentioned before, has all of this kind of mountain of different stuff in it. And the different papers will give you different estimates. Some say 1,000, some say 100, some say 500. This is where I'm comfortable and confident that 550 different reproducible molecules this freak plant is producing. And if you look in the newspaper, well, lately you'll see maybe 3 or 4. There's this Delta 8 thing, there's this CBC thing, maybe CBG. The culture is starting to learn that there's more than just CBD and THC. But we're talking about the cultural awareness is like a tiny sliver of the whole pie. So the industry we have is almost nothing compared to the big picture. And Gio and I were talking earlier about the psychedelics world is already like clamoring for its new day in the sunshine. Cannabis hasn't even started its. It's just a visual version of that. We've all seen the male-female version of this, but it's just not what's coming. No? Oh, this side? Oh, so this is a picture I stole. It's usually comparing men in simplicity to women in complexity, which I guess is probably cancelable in this culture now. But the point I was making here is this is the reality that people think of as cannabis, and this is really the true reality. It's funny, nobody knows that. All right. It's a fun lecture slide. Basically, the take home here is it's all over your body. We have evidence, if people pay attention to it, every single cell really in your body has cannabinoid receptors.
I have a question.
Please.
So is there a way where we can just self-regulate internally instead of exogenous intake?
Yeah, sure. If you talk to people who meditate, they will tell you, like Sting, and you guys are probably too young, I'm going to date myself here. Sting, the singer, you guys know Sting? Okay. He used to say that he had orgasmic euphoria because he meditated. I think his was sex, but people like that, meditators, feel euphoric. And it's the same kind of thing, but they're channeling into that mentality. I don't know. But that's the only way I can understand their reports.
What exactly is a stone over?
Stone over? Oh, like a hangover.
Yeah, exactly.
A great question. The easy answer is nobody knows. The more complex answer is it could be one of a few things. And for different people, probably is different manifestations. It could be that you're still high. It could also be a hangover from alcohol is dehydration. Alcohol makes your body excrete more water or burn it off. And when your brain isn't getting the water it wants, you either faint or you have a headache. And the reason is when you faint, your body goes level, and now your brain gets more blood. So instead of having more water, you're at least getting more blood, which has water in it. Another angle is in your brain, there's a balance of chemistry that can cause a headache, that can cause blood vessels to contract and dilate. Some of these things, depending on what you consume, will have that effect, will either dilate or constrict in a way that gives you a headache because of your normal chemistry. So it's probably some combination of all of those, and different people, it's a different version. Yeah.
Knowing all these nuances, how do you go about when you medicate somebody that comes into your office? Like,
Hmm.
do you have like a baseline for every single patient, or is it based on their history?
It's a great question. Nobody's ever asked that, so it's fun to share. I'm way on the deep end of the science, and I'm a loner there. I don't know that there's anybody that loves the science so deeply. The clinical day-to-day reality is very different. And we think of medicine as prescriptive. I'm going to a doctor, I'm getting a prescription for this pathway which is messed up in my brain, based on studies and what the doctor thinks is best for my brain. Cannabis medicine, in a clinical sense today, is old school medicine. It's not just shamanism, because this stuff is actually working. But I can read all these studies and I can tell you what's happening, but I can't tell you in the person in front of me because I can't study them. I don't have testing, I don't have analysis of their body in a way that gives me insight into this. Even if I used every single test that exists now. And there are companies out there which will say, you know what, give me your genes, I can tell you what cannabis you're born with. And it's bullshit. Because when you have a good day, you have a good sleep, it's going to be totally different. Your endocannabinoid system is dynamic. So it's a real interesting problem. If I'm in a room with somebody and I don't have access to who they really are, I have to bring them to a formulation which I know has worked for other people. So I'm doing shamanism not in the hand-holding, I hope you're feeling well, I'm here for you kind of sense, which actually is therapeutic in its own right, but I'm bringing them into a mixture which won't make them feel awkward. Maybe they don't want to be high, so I'll recommend products which don't have any euphoria. Or they want to feel a sense of control because they've been in pain forever and they want to have command over that. So then I would pick stuff which is not going to have a weird timeline. They'll have very concrete, controllable timeline. So I'm using more basic principles and giving them to the patient in front of me because I'm reading what they need. Does that make sense? It's not a level of chemistry. This is necessary for the industry, but it's not necessary for my patients. Yeah.
You mentioned about sleep. I just want to kind of build on top of what she asked, why are we stone over? So I think when you get high, you do get knocked out fast, but the quality of sleep isn't great, and so you don't have enough of time to recharge. And when you wake up, you're actually feeling out tired more so. So one of the theories is that we don't get enough of kind of recovery when we sleep, and that's when we wake up.
Interesting, and it could be totally valid. I have no idea. I'm going to poke holes in it anyway, because most of us also have this idea that we need a full night's sleep. And if you look at the history, if you take history books, look at old archives, there used to be in human culture sleep 1 and sleep 2.
Sleep 3.
And it wasn't in sleep 3.
Yeah.
Before 1700s, the invention of the clock, the invention of the work week, people had multiple sleeps, just like a siesta. So the idea that we have that we need this one night of full sleep is a human construction. It's really interesting.
It's a modern day approach.
No, understood.
Yeah.
No, understood. And equally, I'm not invalidating your theory at all. I'm just saying that we're all making it up. We're figuring it out, and that's what science is all about. I'm a fighter, man. This is all theory. I'm trying to figure it out based on what I have available, but luckily for me, almost the whole culture is not even trying. Medicine, they don't even care. They just ate whatever sandwich they were doing. This is not really useful other than to take away, it's part of everything. And yet it comes in these flavors. So transfer the science and how interesting and meaningful that is with what you just asked about the clinical reality. And then patients are faced with this stuff in the store because people producing it don't know what they're doing relative to the patient in front of them. The patient has no idea. And these formulations are not going to be laser precise to deliver any product that would be useful for them. One of the things that people have confusion around is what a dose means, what's going to happen. So I put together a chart that explains to people what different dosages are and what they do in general, which is a really hard thing to do if you think about the whole population. Not everybody's the same. And like you were saying, some people have a high tolerance, and so I try to include all that stuff. And imagine writing a book where you have an audience which is the whole general public, the whole medical community, and all the dispensary people. That took me 1.5 years just to figure out how to make the material I wanted to teach digestible by this huge audience that's not internally consistent. That was a fun puzzle. Okay, we talked through all this. So any good steward of medicine will tell you there's good and bad, yet we won't talk about any of the good in medicine. Whoops. So the worst side effects, I think, on the radar today are uncontrollable vomiting, cannabis hyperemesis syndrome. And ERs, if you look at the emergency room data, will say, oh my God, this is a calamity. It's a huge problem. We're seeing this so many times more than we used to. If you, depending on how long you look at this scenario, how long you're thinking about it, you can say, oh shit, this is a real problem. Or you can zoom out and say, wait a minute, a lot more people are consuming cannabis because there's cannabis everywhere. And if that bell curve is getting bigger, the teeny tip of people that are experiencing the extremes is going to get bigger too. The problem isn't bigger, we're just seeing more of it. Confirmation bias. So that's probably the most alarming thing. I see hundreds of those patients, and you work it through, that you help them get to a level of tolerance which is lower, those symptoms disappear. Not the end of the world, it's really an awful thing to experience for them, but it's not a long-lasting thing, it's not a permanent thing. Beyond that, hangovers or stonovers is probably another common one. Dizziness, lightheadedness, people have GI stuff. If the dispensaries are telling people they need to have a tincture, an oil-based tincture, as the way that they consume cannabis, if they're drinking a lot of oil, if anybody had a lot of oil, you're going to get the runs. Or constipation is also a thing people find. So potential side effects is almost everything, just like the potential benefit is almost every system. You can have potential bad effects depending on where the person's starting from.
Can you talk about some of I think some of the things we've learned along the way, like, oh, this is bad for memory, this is bad for, etc.
Yeah, it's a good one.
Could you talk about where those things come from, and I guess how we can
combat it. Sure.
Combat it. Yeah.
Sure. It's funny. People were worried about those things because somebody heard that somebody was forgetful and, oh my God, this is going to make people stupid. So they did IQ studies looking at people who consumed cannabis and people that didn't. And they did an IQ study beforehand, they did an IQ study afterwards, and they found between a 5-point drop and an 8-point drop in the people who were getting stoned. Oh my God, hit the headlines, this is making people stupid. First of all, 8-point IQ drop is a stressful day. Doesn't actually mean anything. Forget that. Let's assume it's making people really stupid. Some guy, actually it was a woman, said, you know what, let's stop people from consuming cannabis 3 days before they take that test. What if they're high while they're taking the test? And guess what? All vanished. The significant results vanished. There was no difference in the IQs of the people who were consuming and those who weren't. It was just a bad study design, but nobody's out there questioning because it matches their internal heuristics. Yeah.
But that sort of stuff happens overall in medicine and healthcare in general. So
right.
There's no point talking about it. But the memory effect of it, that is very real. What I've realized in short term, I'm very present, I'm really enjoying it. But long term, I don't remember. So I started taking pictures and video just to go back into it, and not to relive it, but just to feel it one more time. Just a human thing. But I did notice those effects where the short-term memory, is compromised with THC.
Yeah, no, it's true in the short term. That's what the studies have found. In short term, THC will reduce your short-term memory, in part because remember we were talking about the sort of nerve signaling, the feedback inhibition. It's telling those nerves to chill out, to not work as well. So some of the memory is not forming because those nerves are on lunch break. And there's also a psychological phenomenon called state-dependent learning. If you take a test, if you study for a test when chewing strawberry gum, and then you take the test chewing strawberry gum as opposed to chocolate gum, you're going to do better with the strawberry gum. So when you're learning things consuming cannabis, and then you stop taking cannabis, the state is different out of cannabis. Does that make sense? So there's a lot of psychological phenomenon here. It's not just an A-B puzzle. All of these, I think, are true.
And I would say that it's so interesting to me. I use cannabis really just to sleep, alcohol replacement, really fun, but I'll work with plenty of people who are using it for anxiety as if it's Wellbutrin, as if it's any sort of anxiety, antidepressant. And we will talk about it because I'm so interested and they're willing to talk about it, but it's so interesting to me because I'll tell you, I can see the difference, and they're all there when they're using cannabis because it's medicinal. They're using it in a different way. Whereas I want to forget so I can go to bed and not think about things all night long.
Let me reframe that.
Yeah.
We are worried about airplane pilots smoking up while they're flying, right? Because everybody's on that plane and we don't want them to die. But we are not worried about that lunatic, name your mental health disorder, who's on whatever pharmaceutical stopping that problem. We're not worried about that. Do we assume they're under control? But there's a really interesting perspective we have as a culture that we demonize some things and not others, really unjustifiably. The same logic is not applying. People coming to cannabis might have terrible pain, terrible anxiety, terrible depression, and it's solving those. You know, that crazy man driving down the street, flipping people off and cutting people off, that's his or her baseline. And if they're, say they get high before they get in the car, and all of a sudden they're more chill, they're more respectful and kind to people, they're not as worried about being angry and someone cutting them off, and they're driving better. We're not thinking about that. That's not logical. And that's an interesting sort of element of cannabis, not to go down that rabbit hole, but we don't know how to test when people are level with ideal cannabis consumption for them. Different cannabis strains. I really call this out just to call the emperor's clothes. There's really, it's tough to argue that there is such thing as a specific strain. If you take HBS strain and you grow it in Boston, and you take that same plant and you fly it over to California, different sunlight, different water, different someone singing in the room, you're going to get a different output from that plant. One step further, take that plant just in Boston. The top of the plant, middle and bottom are not the same products. They're close. I'm not saying it's wildly different, but it's not the exact same thing. How do we deal with that? When a culture, right now the business is out there. I have a company that I created, which is surfacing information from the ground up. When you come to me, I'm learning about you, learning about what your effects are, and I'm learning over time what happens to someone like you or reports like you. 100% of the companies out there are saying, oh, you are taking this strain, this is what happens. Or you have this illness, this is the strain that people have told us helps you. It's all bullshit. I mean, there's nothing meaningful there. And some of those companies are putting papers out now that are published based on this fundamental idiocy. And nobody knows it, nobody calls it out, because there's nobody doing this kind of stuff on my side. If we take it a different direction, William Randolph Hearst in the 30s put the kibosh on cannabis as a plant by means of lobbying the government to make it an enemy, because the government and whatever racist was there got his bone to pick. Hearst got his money out of it by ending cannabis as a business competitor of his paper business. Cannabis as a crop is an incredible absorber of CO2. Also produces a lot of oxygen. There's so many opportunities here for healthy construction, for climate-friendly stuff. Cannabis today actually is used, maybe not anymore, I shouldn't say, but historically cannabis has been used if there's a chemical spill in an area. They'll put the cannabis there to absorb, because cannabis as a free plant happens to absorb all the microtoxins in soil. So they take the plant sucks up all these toxins, they throw the plant out. So they essentially clean the ground of these areas. If you translate that to today, someone who's growing in their basement, but I'm using organic soil. Have you looked at their organic soil? Because they don't even test to a micronutrient that cannabis can absorb. So it creates a really interesting public health problem, because people are buying organic soil, they think it's good, nobody's testing it. But if you comb Reddit, you'll see people who are out on the limb, they test their product. Wait a minute, they're finding heavy metals. But they use organic soil, but oh, they didn't look at the organic soil. It's a really interesting problem. One of the nice things about regulation is in Massachusetts, we have the strictest regulatory oversight of any state in the country, actually anywhere in the world. There's a fence of what's reasonable to make a product safe. Massachusetts goes way beyond that. California, coincidentally, has tried to chase Massachusetts because they don't want to seem like they're the slackers. But if you buy product from a dispensary, they're doing such heavy testing that they discover those micronutrients. So you really have a totally different market, which is the regulated market, with some basic science paying attention to the details. Then you have a public awareness that's just completely different.
Question. So is vapes that you would get from a dispensary, are they bad for your lungs?
No, totally clean. That's a different question. I'm answering a question about toxicity. Are you asking me about the density of product, or are you asking me about the toxicity?
I guess like you said, like smoking is like not good for your lungs, whether it's cigarettes or
Yeah, I don't know, it's a good
joints.
question.
What about the vapes?
It is definitely better than smoking, because with both cases you're getting a high density of stuff, but with smoking you're getting carbon, ash, toluene, naphthalene, benzene chemistry you don't want in your body that's harmful. With vaping, you're not. You're not getting much. You're getting an isolated concentrate of the cannabis product. The way vape cartridges are constructed is a oily mass on top of a thin metal plate that's heated. So right touching the plate, you are getting a little bit of combustion, so you can't say it's nothing, but it's as close as you'll ever get. So depending on the construction of the device, you can have different health impacts. And this, of course, is a whole other industry right there. How do you know heating? You can heat with lasers, you can heat with conduction, you can heat with convection. If you have a business that's, one, smart thinking, and you know about the health implications of that business, you can create a whole other business channel there. And me, stupid that I am before I knew about anything about business, oh, there's this neat company that all my patients seem to like their products. The guy actually came here from China. The company's called FlowerMate. And I just sat there and schooled him on temperature and relevance to boiling points. And guess what? 5 years later, their whole line lets you use digital temperature control. And they're the only company on the market right now doing really well. I got shit out of it. It's important, but even if you're not, yes, even if you're not using knowledge for yourself, knowing about whatever interests you will at least help you from being a fool. Did I get at what you were asking?
Yeah, I think so. I guess I also just heard that the chemicals or whatever that it takes to compress it into the concentrate is not good.
So actually, I didn't answer half of what I wanted to, so I'm glad that I checked in. So CO2, butane, these are all inert chemicals, meaning they won't react with anything. They're all terpenes, but they're super cooled so that you can freeze those stalks and have them fall off. The culture thinks that there's a meaningful difference between the stuff which is being used for temperature value. It's all cold. It's all going to freeze these stalks. They're all going to fall off. People will tell you this particular cold chemical is going to have a different effect than this particular cold chemical. I can't for the life of me figure that out. It doesn't make any sense to me scientifically. Because literally its only function is to cool the stalks and help them fall off. But people will swear by it. There are different ways of extracting. What I've described is blowing cold air on these things and they fall off. There's also supercooling immersion. If you have a supercooled ethanol bath, that's different than blowing cold air on them. And people often report that they're getting more of the plant's chemistry out of that. That could be that they're literally cooling more parts of the plant which are falling off. I don't know. But from a certain argument, it's all the same cooling. But we do have statistics that show that look at ethanol cooling in one hand, butane on another, and carbon dioxide, and they actually get different results. So in my mind, the different results is just a sort of confounding variable I don't understand, but I don't believe. Two side notes there that are fun to talk about. If I give you cancer, and I give you not cancer at the same time, what happens? We don't know. It's a weird situation, right? We don't know how to do that. When we look at people who consume a lot of cannabis, smoke a lot of cannabis, you would think they would have a lot of cancer. Actually, they don't. To the contrary, they often have less cancer. So how do we deal with that? We don't know. It's a puzzle. And the idea of meta-analysis is a really interesting problem. So meta-analysis, you guys probably know, but I'll speak it anyway. It's building one paper on top of another and looking at the overall trends of these papers. If you have piece of shit study design, crap analysis, piece of shit study design, and then we're now in a modern age, we have good study design, we're really thinking about it carefully, and you're crunching that stuff all together to have a meta-analysis, you still have a pile of shit. It's a really interesting problem because the scientific community says, wait a minute, where are those meta-analyses? We don't have enough history to be able to do those meta-analyses. So it's a really interesting kind of operational problem. Topical. Interestingly, a lot of people consume cannabis today, maybe 100 million. And they don't have anybody guiding them. And there's an interesting Harvard study a couple of years ago that found about 10% of people who use unguided cannabis have cannabis use disorders. So people want cannabis, they're feeling relief from it, so much that history is the way it is because of them. Who's there to guide them? Nobody. Pot docs are just throwing cards at people with permission slip to get a discount. They're not guiding them in any meaningful way. They're not following them up and learning from them. It's a really interesting problem. We're in a field with nobody. From a business perspective, it's the same story, just with business terms. The businesses out there are really led by, I don't want to speak for you, I don't want to bring you into the equation, but they need therapy. They're hopelessly misinformed. And that's partly why the cannabis industry is flushing itself down the toilet. That you have the blind leading the blind, they're promising things that they can't deliver on, they're producing way more product because they've pitched this and they've gotten investments that they can't meet. It's a really interesting problem from a business perspective as well as the medical one. This is not a thing, there's not medical, there's not rec, it's all therapeutic, is my take. But we were talking before, if nothing else, people are feeling good about it, it's still useful. But we have this industry that says, oh, we can't let that old cancer lady feel bad. We have to have something that helps her have treatment that she wants. Programmatically created an opportunity for cannabis to become legal. So in that sense, and I think it's a little bit harsh. I think my world is medical. I'm helping guide people, I'm teaching them, I'm individualizing therapies and learning about them. But I'm not an industry. I'm just one guy figuring it out.
How do you work with other doctors, part of your patients, like caterers? Like I have a therapist, but I also have a psychiatrist. They don't necessarily talk, they chart, so like, how does that work?
Right. Therein starts the disconnect of modern medicine. That some doctor, if I'm in that group, that chat group, they're not gonna question what I say, unfortunately. And we all sort of work in this disconnected way. The idea of a doctor who knows you, who knows all these sides of you, is now ancient history. And these days, with the dearth of clinicians out there, the old model of medicine where someone actually knows you at all might be changing. We all want the convenience of virtual care, but we forget that it's important someone gets to know you over time. There's therapeutic value there. So it's a puzzle. And at this point, one angle of the book is, for me, that it's my way of reaching doctors out there to let them know what I think is a more fair reality. I do work with some clinicians who are interested in learning from me, and it's like the relationship is congenial and wonderful, but they still just trust me. And I don't love that. I want us to question each other, to challenge each other, to do what's best for the patient. And that just doesn't happen anymore. I talked with the doctor before about the Doximity group, this medical group. It's fascinating to see how difficult it is for doctors to change their views. And everybody's most of everybody, 90%, if not more, have the same view that cannabis is bad for people. And this is going to be its own problem and its own business solution. There are a lot of companies out there that are trying to figure out how to get doctors to the table. If you have this puzzle, you have a substance that's a lot of unknowns and a lot of mystery and a lot of opportunity, how can you bring that to the necessary people? How do you communicate and educate the business people? How do you educate the doctors? How do you educate the general public? There's whole opportunities, silos of businesses right there. And you as an MD, MBA, God, you have opportunities on both sides. Or maybe don't even want to take that challenge. But there's a huge opportunity, I see. And almost nobody thinking about it seriously. I mean, props to you for even coming here and listening. Because this is news that nobody has. And I published a book to try to get the word out, but I can only reach a few people. That's really all I had.
Thank you, man.
These are lofty slides for a big lecture.
Thank you so much.
Any other questions?
I think I'm still going to smoke my joints, but...